Have you ever felt unsure about the anatomy down there? Whether you're in a relationship with someone who has female anatomy or you're simply curious to understand how the body works, this is for you. I'm Dr. Jocelyn, and I've spent the last 5 years working in urology and pelvic health. Today, I'm going to walk you through a clear, science-based explanation of female anatomy without shame, without myths, just real understanding. And be sure to stay until the end, because we'll cover the truth about the G-spot, what it is, where it is, and what science actually says. Before we dive in, do me a favor, hit that like button, drop a comment below telling me where you're watching from, and subscribe so you don't miss future videos. Let's get started. To understand anatomy, we need to begin with development. Early in pregnancy, during the first 8 weeks, a fetus doesn't yet have visible genitals. At that stage, everyone starts with the same basic structures, a genital tubercle and a urogenital sinus. By around week 10, those structures begin to differentiate based on genetics. If the baby has XX chromosomes, those tissues develop into female external genitalia. If XY, they develop into male anatomy. Here's the fascinating part. Many structures in male and female bodies are homologous, meaning they develop from the exact same embryonic tissues. For example, the genital tubercle becomes the head of the penis in males and the head of the clitoris in females. The clitoral hood is structurally similar to the foreskin. The outer lips of the vulva, called the labia majora, correspond to the male scrotum. This shared origin is important because it explains why certain areas, like the clitoris, are incredibly sensitive, just like the penis. These structures are made from the same nerves and blood vessels. The vulva includes everything you can see on the outside: the outer lips, inner lips, clitoral hood, and clitoris itself. At the very top is the clitoris, the most sensitive part and the primary source of sexual pleasure for most women. Stimulation of the clitoris often leads to orgasm. And just like the penis, the clitoris can become engorged with blood, firm, and highly sensitive during arousal. It even has a hood that can move much like a foreskin. And that hood can sometimes stick or form adhesions, which may cause discomfort. Now, here's something most people don't know. The clitoris is much larger than it appears from the outside. What you see, the external head, is just the tip. Internally, the clitoris extends down, wrapping around the vaginal canal with 2 long branches. These internal structures are rich in erectile tissue just like the penis, and they also swell and contract during arousal. Next, just below the clitoris is the urethral opening, the exit for urine, and beneath that is the vaginal opening. The vagina itself is an incredible structure. It's muscular, flexible, and responsive. During arousal, it can elongate by up to 3 inches, allowing for more comfort during intimacy. And of course, it's the birth canal during childbirth, capable of tremendous expansion and recovery. And finally, below the vagina is the anus. That makes 3 external openings: urethra, vagina, anus, each with a specific function. Let's talk about one of the most talked about and misunderstood topics, the G-spot. The G-spot was first described in the 1940s by Dr. Ernst Greffenberg. It refers to an area on the front wall of the vagina about 1 to 2 inches in, often associated with sensitivity and arousal. Some describe it as a small ridge or area that responds to pressure or a come-hither motion. But here's what science says. There isn't one specific anatomical structure called the G-spot. Instead, this area overlaps with the internal clitoral arms and the Skene's glands, which are homologous to the male prostate. That's why some women report pleasure and even ejaculation when this area is stimulated. But it's not a magic button. For many, clitoral stimulation remains the primary pathway to orgasm. In fact, most women require clitoral involvement either externally or through internal pressure to climax. And that's normal, healthy, and supported by decades of research. The clitoris and penis come from the same embryonic tissue. The clitoris is much more than what you see on the outside. It's large, internal, and full of nerve endings. The G-spot is real for some women, but not all, and it overlaps with the internal clitoral network. Female pleasure is diverse, personal, and entirely valid. Now, you might be wondering, why does this matter for me as a man? Because understanding your partner's anatomy isn't just about technique, it's about connection. When you understand how the body works, you can be more present, more responsive, and more confident. You can communicate better, you can listen better, and ultimately, you can create more satisfying experiences for both of you. Many men approach intimacy with outdated information, or worse, with misinformation from adult entertainment. But real intimacy isn't about performance, it's about presence. Here are a few practical takeaways. 1. Communicate openly. Ask your partner what feels good. Listen without judgment. Be curious, not performative. 2. Focus on the clitoris. For most women, clitoral stimulation is the key to satisfaction. Don't overlook it in favor of other techniques. 3. Take your time. Arousal takes time. The body needs time to relax, open up, and respond. Rushing through intimacy reduces satisfaction for both partners. 4. Pay attention to feedback. Watch for breath changes, sounds, body language. These are signals that tell you what's working and what isn't. 5. Let go of myths. There's no one-size-fits-all approach to pleasure. What works for one person may not work for another. Be flexible, patient, and open. And while you're focused on understanding your partner's body, don't forget to take care of your own. Your ability to be present, confident, and engaged depends on your physical and mental health. That means getting regular exercise to support circulation and stamina, managing stress so you can stay present and relaxed, checking your hormones if you're experiencing low energy or libido, supporting your vascular health with proper nutrition and, if needed, natural supplements. Natural compounds like L-citrulline, tongkat ali, fenugreek, and nettle root can support circulation, testosterone, and overall vitality. You'll find links to trusted options in the description below. Gentlemen, understanding female anatomy isn't just about being a better lover, it's about being a better partner. It's about approaching intimacy with curiosity, respect, and genuine care. It's about letting go of myths and embracing real, science-based understanding. When you do that, everything improves your confidence, your connection, and your mutual satisfaction. You are not too old to learn. You are not too old to grow. Small changes in understanding can bring real comfort, freedom, and confidence for both you and your partner. If you found this video helpful, please like and share it. Subscribe for more expert men's health advice every week, and drop a comment below. Let me know, what's one thing you learned today? Where are you watching from? In my next video, we'll explore the topic of female ejaculation, what it is, where it comes from, and whether it's common. So don't forget to subscribe. And as always, take care of your body because you are worth it.